Hi everyone, good morning, and thanks very much for the opportunity to speak this morning and share some of the work that we've been doing looking at the public health priorities with a focus on gender inequality and violence against women and girls. And my starting point today is, I suppose, the fact that a safe community is founded upon kind of those basic principles of safety, both relation to personal safety, but also safety within the public realm, so our communities and neighbourhoods. And that's what I want to focus on for the next 10 minutes or so, thinking about the role and impact of places, placemaking, and our experiences of feeling safe and belonging. So why is public health interested in place? I think creating places that nurture health has long been central to the public health agenda. I suppose back in the early days of public health, this was about safe water, sanitation, improving our environmental health and air quality, for example. But we know both the built and natural environment are key determinants of our health and well-being and have an influence on people's physical and mental health, and particularly on health inequalities. So it is an area of interest for public health, and the quality of our built and natural environment can have an effect on connectivity within neighbourhoods, and the location and quality of our housing, our exposure to air and noise pollution, and safe and accessible transport and opportunities for active travel. So it has a crucial role in promoting access to open space, employment, healthy food options. So all these things that have a huge impact on our health and well-being. And if you think about some of the UK's most pressing health challenges, so obesity, poor mental health, physical activity, and the needs of our ageing population, there are some real opportunities to think about how the built and natural environment around us can influence those things. So when we have well-designed, well-constructed, well-managed places and spaces, we can think about how they can promote good health, how they can promote improved access to goods and services that improve our health and well-being, and in some cases alleviate and even prevent ill health or health decline, and have a positive impact on health inequalities. So when the public health priorities were published by COSLA and the Scottish Government back in 2018, it was of no surprise that place and communities featured heavily. And Public Health Priority 1 exactly looks at that. So it's about a Scotland where we live in vibrant, healthy and safe places and communities, and thinks about and acknowledges the impact that they have on our health, well-being, and the part that they play in addressing health inequalities. And what I want to do in my presentation today is just explore some of the things that we found and looked at in a bit more detail when we started to explore this area of work in relation to the impact of gender inequality, and its links to violence against women and girls, and obviously the clear link to community safety as part of that. And more specifically, I suppose I wanted to talk about the potential for change if we start to consider all of this from a more gendered perspective. Some of the key policy and practice considerations that we looked at to frame our thinking were these things on the slide. So obviously we wanted to think about it in the context of Equally Safe. Public Health Scotland is a key delivery partner for the Equally Safe strategy, as I know many of you are involved in that work as well. And we particularly were interested in looking at that from a public health perspective, so thinking about where interventions and services needed to align across the different levels of prevention. So thinking about what we need to do from a place and a placemaking perspective, from a primary prevention perspective, but all the way through to the after violence occurs, to how we support people to be able to access their places and spaces as part of recovery. We also looked at things like the place principle, the police and wellbeing outcomes, and newer kind of initiatives like 20-minute neighbourhoods. And I'm not going to go into them in a lot of detail just because of time today, but when the slides are shared, the links are there for you to look at that in a bit more detail and think about how you could potentially apply it to your work. So our work particularly focused on the place and wellbeing outcomes. And the outcomes recognise that where we live and the communities and spaces around us have that significant impact on our health and well-being. And underneath each of the outcomes, there are a number of principles. So the principles of equality, net zero emissions and sustainability, which underpin and ideally in embedding or applying the outcomes of each of those themes should be embedded in any policy and action that's taken place. And they're primarily used to provide kind of evidence, consistency and clarity on what is needed for our places to impact positively on those who use them. And when we looked at this, I suppose we reflected that this had a deeper implications for women, particularly when we experience a range of issues when accessing communities, and we wanted to think about the gender considerations on each of the place and wellbeing outcomes. And I suppose the positive thing that we took from this is that the place and wellbeing outcomes, when implemented properly with that consideration for the underpinning aspects of equality, had a real potential to positively interact with actions that can create stronger gendered approaches and also contribute to some of the fundamentals in addressing violence against women and girls. And unsurprisingly, it was when we came to the civic outcome, we found the most striking impacts for women, and they were particularly around these themes of feeling safe, which Dawn has already outlined, some of the stark differences in the experiences of women in this area. So we know that women are much more likely than men to feel safe alone at night in their local area, 6 times more likely than men to worry about being sexually assaulted. And those general feelings about the perception of potential crime we know is a significant deterrent to women and girls using public spaces freely. And I think the fundamental thing here is that the experience, the fear and the reality of violence and abuse impacts on women and girls' freedom of movement in our communities. So thinking about the safest routes to participate in aspects of our daily life are really challenging and providing constraints around using our places. So when women can't use public spaces freely without concern, they maybe feel more isolated from communities or potential support networks. And in terms of those significant vulnerabilities that then creates in terms of harm, we see the direct link to violence against women and the potential that can cause. And I think the other thing that was really clear when we were looking at this was really the impact that it has on a sense of belonging to a local community, and the impact then that can have on negatively impact and generally on our health and well-being. So when we were thinking about this in a little bit more detail, we felt it was quite useful to think about how we use our places and how this is different for different people. And my colleague Irene Beautyman, who leads a programme on planning and is a planner herself across the Improvement Service and Public Health Scotland, uses this kind of journey mapping feature quite often when she's thinking about getting people to think about how we use our places. And just while I'm talking, I suppose it's just helpful for you to think about how you use your place. How do you use your neighbourhood? How do you use your community, your town, your cities? And how does that compare to how other people use it? I think journey mapping helps us to really understand the nuances of individuals' journeys. I suppose from our perspective, we wanted to think about this and think about how taking a gendered analysis approach really helped to understand how decisions, particularly around place and place making, affect women and men differently because of their different experiences in the family and household structures, paid employment, unpaid work, caring and provisioning for others. So I suppose considering whether your journeys and how you use your places are linear, are there considerations that you have to do to take into account the different roles that you have within your life? And we certainly felt that when we were looking at place and the impact of place, particularly on women and girls, this was a really helpful way to understand some of the complexities and the considerations that we hadn't thought about, particularly linked to some of the economic inequalities related to women. So why are there more barriers for women? Well, I suppose we have the fundamentals around some deep-rooted sex discrimination, gender inequality across all aspects of our society. But when we think about place, public spaces have not historically been designed with women in mind, and for the different roles that women fulfil. So many of our public spaces have failed to consider the different ways, so thinking back to that map, the different ways that men and women use our places. So we know that there's a higher likelihood of women fulfilling most of the caring responsibilities within a household. So that challenge of being able to combine paid work with caring roles due to the spatial patterning of work, schools, housing, childcare services, for example, make that really challenging. So the spatial patterning, basically where places are placed within your community or neighbourhood, often can create barriers for women. Public transport environments particularly are often designed to provide routes in and out of urban areas, so the home to work journey, for example, and often designed around standard working hours, so don't take account for different journey patterns, different work patterns, multitask journeys that include work, childcare, family care, and other responsibilities. And then that has a significant impact too for employment and employability when we consider the barriers to women getting to and from work and balance and other roles. So this is then linked to things like the gender pay gap and links to the economic issues for women. And I think sometimes when we look at this slide and the list of things, it's quite challenging to see the links directly to violence against women and girls. But if you think back to one of my earlier slides where we looked at the things that needed to be put in place to address and tackle and eradicate violence against women, these are the things that fit into that primary prevention category. So creating the places, creating the environments in the society that creates a place that's more reaches more gender equality is really part of that kind of primary prevention when we're thinking about addressing violence against women and girls. And just to tie up this bit, when we were looking at this within the team within Public Health Scotland, we found that there were two main things that could sum up the experience. And the first was that personal safety and personal safety fears and perceptions for women create significant barriers and exclusions within our communities. And the second major thing, the barrier, was linked to that challenge of being able to balance home, work, life, care because of the way that our places are designed. But I suppose the positive thing that comes out of this is that we know that if connections were better and more joined up, it could create opportunities to have greater a sense of gender equality in our places through our places and placemaking. So as part of this work that when we looked at the public health priorities, we came up with a range of recommendations, and we were really conscious that we wanted to make the recommendations relatable for people, but we also wanted to align them again with those different levels of interventions and services that needed to happen to have an impact across the levels of prevention. So we've got some things that are kind of quite systemic and maybe out of a lot of our spheres of influence, and then we tried to make other things more practical that we felt that we could have a little bit more control over. So we had something quite fundamental about how we adopt that whole system public health response to our understanding of violence against women and girls, which simply means we take a population approach whilst understanding a need to focus on particular areas and interventions, and that is based on evidence and underpinned by good data and intelligence. So that's the place that we're that the aspiration that we're aiming for. We wanted to encourage people to consider women's different requirements when it came to things related to place and planning, particularly in relation to all the needs and outcomes in the place and wellbeing outcomes. We asked people to consider existing tools that were in place. So the Place Standard tool has been used in all local authorities across Scotland. So just that consideration of how the use and the implementation of the Place Standard tool could support efforts to reduce and eliminate violence against women and girls. And then I think Councillor McGregor talked about this in her introduction, just about the need for leadership across the system in this area and an acknowledgement of different people's roles in progressing it. And then I think there are some fundamental things just about how we operate in relation to gender sensitive policies and programmes, incorporating gender equality as standard practice, and then that balance and diversity in terms of representation, particularly when it comes to decision making, planning and community consultation. And What I would say, I suppose, is the major caveat to all of this is that we know that creating communities that feel safe and that are positive places for women and girls is really critical, but actually we know that to address violence against women and girls, we need collective action across all areas of public policy and practice. So it's how can we make the improvements in our places while doing that alongside the rest of the system that are working consistently for the same aims. And I just want to finish with this, with our What's Next slides. And this was from an event that we held earlier on in the year where we asked participants to think about the things that they could personally do around this area of work. So I'll just leave this with you to consider some of the things that maybe feel a bit more realistic. So identifying local opportunities for multi-agency approaches. So do you know your Violence Against Women Partnership Coordinator, and is that link being made to the Community Safety Partnership and the opportunities to take a more gendered approach to planning? Could you think about the place and well-beings in your work and how you design your services, for example, or how your organisation operates? And actually, the fundamental thing is about asking women within your organisation about their own experiences and being able to apply that learning and practice as well. So thank you, everyone. I'm just going to stop sharing.